Our next talk really takes us from molecules to people, particularly to children living with chronic pain. I'm very proud to introduce this next individual who was my PhD student as well as my long-term colleague in the Research Institute at the Hospital for Sick Children and the Bloomberg Faculty of Nursing at the University of Toronto. Dr. Jennifer Stinson has led pioneer work in developing digital health tools that give young patients a voice in their own care. From interactive apps to virtual education, she's reimagining how technology can support empathy, assessment, and management in pediatric pain. Her work shows us that innovation isn't just about new devices or drugs, it's about designing care that truly listens. Please welcome Jennifer Stinson, who will talk on digital therapeutics for pediatric pain, innovations in education assessment and management. Jen.
Thanks, Bonnie. Thanks, everyone. I want to thank the Gairdner Foundation, and I want to thank the board members who actually were traveling around with us for the last few days. So I can't be in Toronto and not congratulate the Toronto Blue Jays, but the reason I put this up, so we can give a round of applause, is that science is a team sport. And you've heard from my last two colleagues that really the problems we're trying to address today are so wickedly complex that no one discipline, whether it's medicine, nursing, or science, can really address them. We have to all work together to do that. And I'm going to outline how I do that in my lab. So most people think chronic pain is something that only older people get, like myself. But 1 in 5 children and 1 in 5 adults will live with chronic pain. This is costing our Canadian economy $55 billion. And probably 60% of young people that have chronic pain will go on to be adults that have chronic pain, so a lifetime of disability. And my lab is trying to minimize that. We know chronic pain can impact all aspects of a young person's life. This is Cleo Flischer. She was a patient in our chronic pain clinic at SickKids, and she drew this artwork for the Canadian Pain Society Art Award, and she won in the theme of pain and mental health. I'm just going to read what she described, this picture is describing. I'm a 13-year-old girl, and I've been living with chronic pain for more than 5 years. I drew this image to express to people how I feel when I'm in pain. It's like I'm drowning. I'm submerged underwater. Pain consumes my whole body. I'm helpless. There's nothing that I can do to stop the suffering or help myself. My lab is about helping these young people like Cleo help herself. In Canada, most recently in 2019, we now have an action plan for pain. So we have 6 priorities where we're trying to focus on to improve the lives of Canadians living with chronic pain. My lab is focusing on 3 of those. 1 is improving access to timely, equitable, and person-centered care. The other thing we're trying to do is increase the education of healthcare professionals. One of my colleagues in the Faculty of Nursing did a study, and it showed that our veterinarians have 5 times more training than healthcare professionals do. So our pets are getting better pain care than our children and adults. And the final part that we're trying to do in our lab is make sure that the digital therapeutics that we develop are really equitable approaches and really get to those communities that are really equity-seeking populations. The other overarching frame that just came out in the last couple years really matches on to what our lab does. We're trying to make pain better. We're trying to make it understood. We're trying to make it visible because it's often invisible. You can look at someone and they don't look like they're in pain. And we're trying to make it better. I wanted to just tell you a little bit about my journey. I'm the first nurse to receive this award. And nurses play a key role, thank you, in our healthcare system. I've talked to so many people over the last few weeks, and they're saying, you're the glue in our system. You know patients best. And it's true, we do. But what sparked my interest in science was a grade 11 chemistry teacher. And that's why I have a Bunsen burner over there, because he literally, no pun intended, just ignited this passion in me for curiosity and science. And it was because of a family member that was hospitalized in the ICU that I saw the power that nurses had and the incredible difference that they can make in people's lives. And it changed my course from trying to be a chemist to be a nurse. But I still was really interested in research, and I've been at SickKids my entire career. It's a fabulous organization. I went back to school early on. Within the few months of being at SickKids, my nurse manager said, Jennifer, you ask way too many questions. Why are we doing it like this? Why are we not doing that? And she said, you need to go back to school. And it was true. I went back to school to learn the research methods to address questions that were so important to patients and families. I then went on, I worked in the acute pain service, and that's where I got hooked on pain as a problem and what we could do to try and minimize that. At the time, there was no nurse practitioner training in Canada, so I commuted for 2 years from Toronto to Buffalo to do my nurse practitioner, and then came back to SickKids, worked on the acute pain service again, and then went back to do my PhD with Dr. Bonnie Stevens. And I got a faculty position, and I liked it, but they didn't value what I did as a clinician. And so my dream job came available when Dr. Razant and other people at SickKids created the first nurse clinician scientist position in Canada. This is my dream job. Who goes to work every day and absolutely loves what they do? I do. It's amazing. But I show this to show the young people in the crowd that don't underestimate the power that a simple change in direction in your life can make in terms of where you end up. So I also helped during my PhD to create with Dr. Stephen Brown the chronic pain program in Canada, which is the largest tertiary pain program in Canada, and this are my colleagues, and all my work really stems from there. And this is my lab. My lab is at the back of the room back there. But our whole goal is to try to develop solutions that empower young people to take control of their lives. They know there's not a magic pill that's going to take away, or someday there may be, like CF, but right now we don't have that for chronic pain. In our lab, what we do is we really focus on this funnel. So digital therapeutics are evidence-based software interventions to use to manage, prevent, or treat medical conditions. And at the core principle of everything we do is that it has to meet the needs of the patients and families. So we co-design everything we do with patients and families in collaboration. We develop them, and then we always have our sight on the end game. We want to implement them. So one of my colleagues, Christine Chambers, we'll go back. She did a study looking at evidence-based digital solutions for pediatric pain and found that 2/3 of them never made it into implementation. That's a lot of research waste. So my lab's all about preventing that and make sure what we develop gets into the hands of patients and families. Dr. Katie Burney was one of my first postdoc fellows, and what we did was a James Lind Alliance priority setting initiative for chronic pain, because as a researcher, I can say, this is what I think we need to develop. But what's more important is, what do patients, families, and clinicians think we should focus on, our priorities? And two of the top things that they told us was, one, improve access to care. Right now, to come see us in our chronic pain clinic, patients can be waiting up to a year to see a specialist, if not longer, in other pain clinics across the country. And what can we do to reduce disparities? And then also, how can we train healthcare professionals to be better providers in terms of pain management? So I'm going to talk a little bit about how we can make pain better. One of the things that Dr. Pat McGraw, who's my postdoc supervisor, and Bonnie Stevens developed was this training network initially funded by CIHR to train the next generation of pediatric pain researchers. So I was a trainee in that program, and now I have the pleasure of overseeing that training program in my lab at SickKids, and we've trained over 400 pediatric pain researchers, and Canada is known because of this, because of the high number of pediatric pain researchers we have. But you can see we're not just training them in Canada, we're training them in developing countries as well. What can we do to make pain better understood? So one of the first applications that I developed was for young people with cancer. So we know that pain is a problem in kids with cancer. At the time that I developed this app, more than 12 years ago, we were moving cancer care from the hospital into the home. But we didn't have really good mechanisms to assess symptoms in a home setting or in a school setting or wherever they were. So I developed this app called Pain Squad, and then I'm going to hopefully show you a little video about it.
This is the Hospital for Sick Children in Toronto. Within these walls every single year, thousands of children are battling cancer and are having to undergo terribly painful treatments. Children like Olivia, who 8 months ago was diagnosed with Ewing sarcoma. The hospital is continually trying to minimize this pain, but to do it, they must first understand it better, and most importantly, discover the medications that are working best. To do this, they need these young patients to record exactly how they're feeling in a pain journal. The challenge is that after multiple chemotherapy and radiation treatments, many kids are too tired or discouraged to even hold a pen, much less keep a detailed journal. And the sad reality is that if this data is not collected daily, it's useless. We needed to find a creative solution to collect data every single day, and with the Pain Squad mobile app, that's just what we did. To begin, our patients were enlisted as recruits in Pain Squad, a special police force dedicated to hunting down pain. We gave each recruit an Apple iPhone loaded with the Pain Squad mobile app. Then twice a day, an alert from headquarters told patients it was time to complete their pain reporting mission. Because the reports worked with iPhone's user-friendly touchscreen, kids could easily fill them out. With a simple flick of the finger, they could identify exactly where and how much it hurt, as well as which medications were working best. But making it easy was, well, the easy part. We knew to be truly successful, we needed to find a way to encourage our young target daily. So we called in some police reinforcements.
Hey rookie, welcome to Pain Squad. It's really great you're here. We need all the help we can get to help put pain in its place.
We brought together the casts of Canada's top police dramas, Flashpoint and Rookie Blue, and filmed a series of inspiring videos, then deployed them throughout the app. To encourage the kids to fill in their reports, we built in a graduation structure. When a recruit completed 3 reports in a row, they received a message from HQ informing them that they were moving up the ranks.
You are now officially a full-fledged detective in Pain Squad. Well done.
At this rate, you might even be the next chief.
Don't stop now. You're almost there.
You truly are one of Pain Squad's best and brightest. Keep it up.
Back inside the precinct, recruits could check to see when to fill out their reports and how many badges they had earned. And once their last report was filed, they were sent one final message informing them that they were being retired from the field.
But this case isn't closed yet. Your squad is still fighting. We couldn't have done it without you. So way to go.
The Pain Squad app is now set to roll out into 4 other Canadian hospitals. And due to its success, it will soon be made available everywhere.
The app is an excellent tool. That's her control over the pain because she's able to document it herself, but she's using an app. She just glides right through it and it makes her feel that she's a part of this. It's fantastic that you all were able to come up with this. It really helps.
Just got the word from Chief. Turns out you've been doing so great, he feels like you're ready to move up. You're well on your way to putting pain in its place. Don't stop now. You're almost there.
Congratulations. Sergeant.
So we then went on to do the studies to make sure that it was reliable, valid, and responsive to pain treatment. It's freely available in the iOS store. But this app was only able to assess pain, and what we really wanted to do was to be able to manage pain. So my first PhD student, Dr. Lindsay Jibb, actually developed PainSCAN Plus. So based on the assessments, it would provide a clinical algorithm on advice to manage the pain. We got funded by CIHR and the Canadian Cancer Society, and we're just completing a multi-centered randomized controlled trial of evaluating this app in children with cancer. So let's look at how my lab is trying to make things better. So one of the things that I hear as a clinician all the time is patients say to me, Jen, I don't know anyone else that has chronic pain. Can you please connect me with someone? And as a clinician, you're often leery about just connecting people without any safeguards in place. So my second postdoc fellow, Dr. Sarah Ahola-Cahoyt, together and myself, we created the iPeer-to-Peer program. So this is a program, well, I'll show you the video and then I'll tell you more about it.
Hey there.
Hi.
I'm Liz.
And I'm Lindsay.
So were you a little nervous for this call?
Yeah, a little.
I'm super nervous, so I won't lie. So I don't know much about you, but I'll tell you a little about me. I'm not exactly sure the type of arthritis you have, but I'm assuming you do have arthritis, right?
Yeah.
Okay, so I have systemic juvenile.
Being a teenager can be stressful. You have a lot to think about, like school, friends, family, hobbies, and everything else. Now imagine being a teen with a chronic or long-term disease. You would also have to think about and manage medical appointments, medications, and therapies, and all when you're not feeling 100%. Learning to be independent and take care of yourself and your health can be complicated. Many young people who are living with a chronic disease have never met another teenager with the same condition. It is easy to feel like nobody around you gets it. So to help, a team of healthcare providers and researchers at the Hospital for Sick Children developed the iPeer-to-Peer program. iPeer-to-Peer uses online video calls to connect young people living with the same disease. Teens are connected with someone a little bit older who has gone through training to be a mentor. This is someone who gets it, someone who has been in the same situation and has learned how to cope.
My name is Shayla, and I live with chronic pain, and I am a mentee.
My name is Carly, and I'm a mentor.
My pain story started in 2010 when I was in a motor vehicle accident. So I have pain from my neck all the way down to my feet. I have nerve problems in my feet. It was really difficult for my friends to understand because obviously they're not going through what I've been going through.
One of the benefits of this program is that it was completely online. So there was no geographical limitation whatsoever. So if you were getting treatment at a hospital anywhere in Canada, or if you were living across the province, or even in different time zones, you could still connect with your mentee because it was all online.
I'd Skype her on my bed, I'd be like this with my phone up here, hey, yeah, I'm not feeling well. But with the Skyping it was really easy because it's I could still feel bad, but that would be the best time to talk to my mentor.
This is a program that I never had the opportunity to experience while I was a patient here at SickKids. I wish I had had the opportunity to meet a mentor, someone older who successfully was managing their pain and could learn strategies from them.
She offered me a way how to live with what I'm dealing with, because I know one of my biggest things was being able to accept it, and I ended up telling my mentor that, and she said that the only way for anybody else to understand what we're going through is in order for us to understand it ourselves. Yes, I've had bad days, and yes, I will have bad days and continue to have bad days, but what you do on the good days will overpower the bad days all the time.
This is such a promising program. I can reflect on even one of the mentees that I had that they mentioned that they are looking forward to actually being a mentor one day and hopefully having this experience available to them just because they enjoyed the conversation that we had and the relationship we built so much.
I'd love to be a mentor in the iPeer-to-Peer program because I've seen how it's helped me, so I'd love to give back and help someone else never give up, keep going. Remember where you started off, it would be good to be able to get that motivation back going and being able to help someone else.
I actually don't have any other questions. No, it was really fun being your mentor.
It was really fun being your mentee.
So if you have any other questions or anything, you know where to find me. And good luck with everything.
So everything in my lab we do in a phased approach. So we did needs assessment with young people to ask them about what components they would want in this. We did a systematic review of evidence on peer support programs, and we found that programs that provided in-person more frequent and matched same-aged peers tend to have better results. So we developed a 2-day training curriculum. We had healthcare professionals refer patients to our programs. We've tested this program in youth with chronic pain, arthritis, sickle cell disease, IBD, cancer, congenital heart disease. We actually have a project with sickle cell going on with people in Ireland. And then we have found that this program really improves self-management skills, results in more positive coping, and actually helps people feel prepared to transition on to adult care, which is very scary. But what's most important and promising about this program is that we've already licensed this to not-for-profit organizations who are now carrying this work forward. So Cassie and Friends is an organization in Canada that focuses on young people with arthritis, and they're the ones that are continuing this program for that population. I want to switch quickly into how we can help children with pain in the hospital setting. So about 8 years ago, I started using this robot called Medi in children who were undergoing port access. So they insert a little dome under your skin. There's still a needle that has to go in there for kids to get chemotherapy. It's often distressing for young people. But the robot, we programmed the robot clinically in terms of the steps that would happen. And I'll just show you a little video of Medi.
Pain and anxiety are frequent and significant problems related to cancer treatment procedures for children. Children with cancer often cite needle procedures as the most distressing experience caused by cancer and its treatment. Specifically, the insertion of a needle into a subcutaneous port has shown to be painful, frightening, and distressing to children.
My name is Letty. Please come right on in and sit with me. I work here and get to visit with you.
Based on evidence that we know works to reduce needle pain and anxiety in children, Dr. Stinson at the Hospital for Sick Children decided to investigate the impact of an interactive and friendly robot we called Medi in decreasing the pain from port accesses in 4 to 9-year-olds battling cancer.
I'm going to do some stretching to relax my muscles. You can do it with me.
I'm just feeling. Look, watch Medi. He's here for you.
Sit tight. I'm here for you. Time now for a little clean. It will feel like cool water on your skin. I will be here with you to help you feel brave. Everyone here is very proud of you, including your nurse. Do you have a superpower that makes you so brave? I meet a lot of kids and they showed me something really cool. I'd like to share it with you. It's called belly breathing. You can do it whenever you want to relax. Take a slow breath in through your nose. Hold your breath for 1 or 2 seconds. Now let out the air slowly through your mouth. Wait for 2 seconds. 1,000 to 1,000. Ready? 1, 2, 3, 4. You are being really brave, just like your favorite superhero. Fast girl! 4, 3, 2, 1. Faster! Did you know that when superheroes need to relax, they count to 10 slowly just like we did?
Okay, now let's do a bow.
You're all done.
Woohoo!
You did a great job. I'm proud of you.
Medi's interactive vocalizations and movements are key to engaging the brave young patients at SickKids in a world away from the distressing procedures they need to undergo to battle cancer.
So the problem with that robot was we built it based on clinical scenarios in terms of what we thought was what was going to happen. But anyone that works with children knows it never goes that way. So I've partnered with engineers in Glasgow to do an AI-enhanced robot. So this robot can actually hear what's going on in the room. It can see what's going on in the room in terms of the child, the nurses, and the healthcare professionals. And so we just completed an RCT, and although we didn't find any significant difference between the group that had Medi versus the control group, you can see there was almost a signal for reducing distress in this population. But what was most important is the patients and family and staff loved this robot. And so now we need to figure out how to implement this in everyday clinical practice in settings for children. I'm just going to quickly talk about another innovation that happened during the pandemic. So in our lab, we have been using VR for children, but during the pandemic, it shut down access to physical therapy treatment. So we partnered with a group at Stanford that developed a program called Fruity Feet. And this VR can actually be triggered by the physical therapist to focus on certain limbs that are painful for the child. And we just completed a pilot trial looking at this in terms of the custom software, off the shelf, and standard care. And this was a trial where no one wanted to be in the control group. So it was like we had to offer, obviously, the VR afterwards, but you can see it was highly acceptable. People felt that it reduced their pain so that they could improve their function, and they were very satisfied with this. The last application that I'm going to talk about is an application that I'm very proud of. It's called I Can Cope, which is a digital platform to help young people better manage their pain, and Dr. Chitra Lalu is the research lead in my lab for this. This is an app where it allows people to do brief check-ins about their pain, and then based on that check-in, it will push them goals that they can set related to sleep, mood, and then based on the goals, it pushes them advice in real time to help them. We've tested this application in arthritis, chronic pain, sickle cell disease. We're just finishing a trial in postoperative pain. We were funded to do a trial in older adults with neurofibromatosis. And I just want to talk about the trial that we completed with young people with sickle cell disease who are a real equity-seeking group and often struggle with access to care. And I mentioned at the beginning, everything I do in our lab, we partner with patients at the center. So Gail and Jermaine were our two patient partners that helped us develop this app and make sure the content was relevant to young people. We then were funded by NIH to do a large-scale randomized controlled trial where they were randomized to the app or an education control group, and then we monitored them 6 months out. We randomized about 60 participants to each group, and in a sickle cell trial, we actually had pretty low dropout because these patients historically have higher dropout rates. But the takeaways were that we really were able to recruit people in this, and that the young people completed the outcomes at 3 and 6 months, and that we found significant improvements. So these young people not only have acute pain from vaso-occlusive crisis, but they have chronic pain. And so we found that they had less days with pain and less painful episodes. They had reductions in, or improvements in their mood out to 6 months. And there was some change in terms of reduced in activity limitations and interference with pain. These are just some quotes that young people said. If I didn't have a good day, I would mark it down. It would encourage me to try harder and have positive energy. If I didn't have a good sleep the night before, I would put in my little score, and then it would encourage me to go to sleep earlier or try other strategies. We now got funded by CIHR to do what's called an implementation trial. So we're implementing this app in the sickle cell clinics across Canada, where we're doing a preparatory phase, trying to find out how the clinic staff will prescribe this to patients, what might some of the barriers be, what might some of the facilitators do. We'll implement it, and then we'll develop a roadmap to scale this up. The last intervention I want to talk about, and again, it speaks to researchers being nimble during the pandemic. Again, I talked about how the pandemic shut down all the chronic pain programs in Canada, so I was funded by CIHR to develop a one-stop shop where young people could get evidence-based strategies. So our I Can Cope app's in that. It was co-designed by young people, and we have 2 trials underway right now. So just to wrap up, I think hopefully I've convinced you that technology is a way forward with young people. Some of the things that we're working on in the future are how we can integrate better AI components. So we're integrating a chatbot into the sickle cell program. And we know it's going to be challenging to implement digital technologies because we do have fragmented healthcare system. There's inequality in access to care and limited system integration in the hospital settings. And we also want to make sure that we work with policymakers to ensure we can develop the infrastructure to implement these more rapidly in the hospital setting. So again, closing thoughts, it's important that we use equitable inclusion of young people. Their voices are critical. I think you've heard all the speakers about how it's important to listen to and learn from patients. I'm really committed to training the next generation of pediatric pain researchers, so I'm hoping in the future to see another pain scientist up here, another nurse on the podium, and that digital interventions really can successfully empower young people to improve access to the care that they need. And new technologies such as AI will enable us to enhance therapeutics, but we need to make sure that we put the guardrails on, especially around AI, ensuring patient safety. So with that, I just want to thank you for listening.